In this question, we are given a scenario. In this scenario, a patient wishes to consult their doctor through a video call, due to the inability to visit the clinic. Which technology-based method is the patient seeking? So let's look at our choices. So the first choice is remote patient monitoring, or RPM. And remote patient monitoring, we see the word monitoring in it. So it's not exactly a typical visit that a patient and a provider would have. This is more of telemedicine that would involve monitoring the patient's vital signs, maybe through an external device. Maybe they're going for a study where the patient's being monitored for seizure activity or some other measurable outcome that the provider is watching or monitoring on their end. But this is not the same thing as consulting a doctor through a regular video call visit, consulting and a visit like this patient is seeking out right now. So we can eliminate choice A because this is a little bit different. Option B says secure messaging. And the secure messaging or secure chat is a method that allows providers to communicate with other providers, other healthcare professionals, or potentially the patient and the provider themselves through a secure messaging system, so it prevents it from getting leaked into their data, getting hacked to the wrong hands. It allows them to communicate safely and securely. And that's great, and that's very helpful for the provider and the patient to stay in contact outside of office hours. However, this patient here, if we look back at the question, is asking for a video call. And this is talking about messaging. Therefore, this is not exactly what the patient is looking for either, so we can eliminate option B. Option C is discussing direct messaging with a provider, and this is very similar to option B. This also is discussing a messaging or a text-based communication system to allow a patient and provider to communicate outside of their visit, which is also very useful, but not what the patient is asking for when they're looking for a video call. So we can eliminate choice C as well. Option D states telehealth. And telehealth is an option for patients to create an appointment with their provider without actually coming in for a visit, including video call capabilities. Telehealth is a broad term, so there are other methods that might be included in telehealth, but telehealth does encompass video call capabilities, video calls. And as a matter of fact, sometimes when you make an appointment with your provider, there will be an option to say in-person or telehealth, because telehealth is sometimes used as the term to describe specifically video calls, which is what the patient is looking for here. So we could go with option D.